Everyone, myself Dr. Namrata Vithalani. I am practicing as a physician and intensivist in Surat. Today we will discuss regarding an important drug called as Diltiazem, which belongs to the class of calcium channel blockers. There are two varieties of calcium channel blocker, dihydropyridine and non-dihydropyridine. Diltiazem belongs to the non-dihydropyridine derivative and it's a benzodiazepine derivative. Now, what is the mechanism of action of diltiazem? So basically it's a calcium channel blocker, so it blocks the calcium influx in the cardiac myocytes and causes the smooth muscle relaxation. It causes the coronary arterial vasodilatation as well as peripheral arterial vasodilatation. So what are the indications based on this mechanism of diltiazem? Diltiazem's FDA approved indications that includes the hypertension, supraventricular tachyarrhythmias, chronic stable angina as well as vasospastic angina. Now let us understand how it works in all these diseases. So diltiazem, as it is causes the smooth muscle relaxation, decreases the afterload. It is useful as an antihypertensive agent. It has got negative inotropic and chronotropic activity. It decreases the heart rate and it causes the AV nodal blockage. That is how it is useful in the supraventricular arrhythmias. Now next is it also causes the causing smooth muscle vasodilatation. It also causes the coronary arterial dilatation, so it is helpful in cases of angina. So this we are discussing are the important cardiac FDA approved indications of diltiazem. Now how to use diltiazem? So it is available in both oral and IV form depending on the condition. Say for in cases of emergency, in cases of arrhythmias, supraventricular arrhythmias or atrial arrhythmias, we if needed we give it by IV route. What is the dose? It is 0.25 milligram per kg IV over 2 minutes. If needed, if the adequate response it is not achieved, we will repeat it in a dose of 0.35 milligram per kg of adjusted body weight after 15 minutes and it has to be given over 2 minutes. In which conditions you will be cautious while giving diltiazem? So that is, as it causes the hypotension, it decreases the heart rate, it decreases the myocardial oxygen demand. As it decreases the heart rate and decreases the blood pressure, we need to be cautious in patients having hypotension, cardiogenic shock, heart block, bradyarrhythmias, as well as the drugs which decrease the heart rate, that is the beta blocker. So you should be cautious in this category of the patients, while you should be cautious while using co-administering beta blocker and calcium channel blocker. You should be cautious in patients with the cardiogenic shock or patients with the hypotension, in patients with the bradyarrhythmias. So this we discussed is about the IV route of diltiazem where we are using it in supraventricular arrhythmias such as PSVT, atrial fibrillation for the rate control, etc. Now oral formulation is also available, which is available in the form of immediate release, extended release and controlled release formulation. Generally we do start with the 30 to 60 milligram 6 to 8 hourly is the starting dose, and even the controlled release or extended release tablets of 90 milligram 120 milligram it can be used. The tablets are also available up to strength of 180 to 40 milligram. Dose can be increased up to 320 milligram, 400 milligram, etc. depending on the clinical condition and patient's tolerance to this medication, because it causes dose dependent decrease in the heart rate and hypotension. So you need to be cautious. Now which other in cases of organ dysfunction, generally renal dysfunction, dose adjustment is not required, but in cases of liver dysfunction, mild to moderate liver dysfunction, also dose adjustment might not be required, but it is extensively metabolized by the liver, so on a long run or a severe hepatic impairment it may cause toxicity. Thank you.